Hi, everyone. Welcome back to another episode of Ask a Care Manager. My name is Ryan Abramsky. I'm the Director of Business Development. And I'm joined as always with Teresa Jackson, our Director of Care Management. The both of us work for EasyLiving. We're a home care and care management agency serving the Tampa Bay area for now over 22 years. As always, the Ask a Care Manager video series are brought to you by our friends over at the Senior Living Resource Magazine and their website, seniorlivingguide.com. Your one-stop local and statewide resource for all things senior housing and health, anything from senior living like assisted living and memory care, to home care services like EasyLiving, care management services like EasyLiving, and any other kind of senior financial or living resources. Check out the Senior Living Resource Magazine and their website, seniorlivingguide.com. And they will deliver it right to your home. Just reach out to them. They will mail you an issue. And you can check out our ad on page 80 of the magazine. Welcome back, Teresa, to another one of our episodes.
Thank you.
Today we are going to continue our discussion on strokes. So as we all know and discussed last week in our episode, May is Stroke Awareness Month. And we know this affects a lot of people, and it does become a debilitating situation when someone does have a stroke. So last time we did talk about the warning signs and symptoms of someone having a stroke, and also the imperative situation of getting help right away. Whether or not you know it's a stroke or not, time is of the essence. So now we kind of want to talk about some of the risk factors and other things that go along with the potential of increasing someone's chances of having a stroke, and what may be some of the things that they can do to kind of reduce those risk factors as much as possible. So Teresa, why don't you tell us a little bit about some of the risk factors that people might want to look out for that they can maybe help manage themselves right now and change those things?
Well, I don't want to sound like a broken record, but oddly enough, having overweight or obese or having physical inactivity are two of the most significant risk factors that are out there. So once again, it boils down to eating right and exercising. Mm-hmm. But some of the other risk factors that are very much considered and very important are heavy or binge drinking. So someone that's a heavy drinker or someone that does a lot of binge drinking. And also the use of illegal drugs such as cocaine or methamphetamines. So that those two can increase somebody's risk factor for having a stroke. Some additional, like just medical risk factors that you need to take into consideration would be like high blood pressure. So, being able to control your high blood pressure is very important. And we're still having to talk about this in this day and age, but cigarette smoking or secondhand smoke exposure can be a risk factor. High cholesterol, that again, we always think about our diet, but sometimes someone might have a genetic predisposition to having high cholesterol.
Yeah.
I had a friend who she watched everything she ate, but she still had very high cholesterol.
And probably needed a medication to manage that.
Exactly.
Even though she did everything right, sometimes
it's just genetics.
Yep.
Being diabetic, that can increase your chances of having a stroke. One that you hear more about these days is sleep apnea, so obstructive sleep apnea. It seems like every other person I talk to, they're on a CPAP machine. Yeah. Yep. Mm-hmm. Just your basic cardiovascular disease, heart failure, heart defects, heart infection, abnormal heart rhythm, such as AFib, those can also be a contributing factor to one's risk of having a stroke. And again, family history. We talked about genetics, so family history. If you've had family members, that's always good to know. Why did grandma, grandpa pass away? What was their medical history? Mm-hmm. And one that we talk a lot about right now, having a COVID-19 infection that can actually increase your risk of having a stroke. So those are the medical factors that we look at. Now, Some other factors that are associated with risk, age. If you're over the age of 55, you have a greater chance of having a stroke. If you're African American, African Americans have a higher risk for having a stroke than people of other races. And men actually have a higher risk factor than women of having a stroke. But women, they're usually older if they have when they have a stroke, and they're more likely actually to die of having a stroke than a male.
It's always us men that are always, risk factors for everything.
Exactly. And then again, hormones, like the use of birth control pills and hormone therapy that includes estrogen, that can increase someone's risk factor for having a stroke as well. So
yeah, I think it's super interesting too that, we're about a year and change of, the COVID pandemic. And it's interesting that you state that strokes are, a higher risk factor for those who've had COVID. It's going to be interesting to see, over the next 5, 10, 20 years, what those numbers are like for those individuals that had strokes and whether they actually had COVID-19 or not, to see if that is going to be a growing trend that we see affect these individuals that have had it. So it's definitely something interesting to see that, maybe we're quote unquote getting into the tail end of the pandemic, but we don't know what the lasting effects are going to be.
Exactly. And you're absolutely right. It'll be interesting to see the long lasting effects that COVID-19 has had on not just strokes, but other medical issues.
Absolutely. So what are some of the things that people can maybe try to do to reduce these risk factors as much as possible, or other medications? What are some of those things as well?
So again, I will elaborate, but it boils down to, exercising and eating right. So, controlling your high blood pressure, controlling your hypertension. If you do have high blood pressure, make sure you stay on the appropriate medication. Make sure you're following up with your physician. You might not be doing in-person visits at this time, but you might need a telehealth appointment. Our care technology program can help someone monitor their blood pressure. So just making sure you stay on top of your medical issues, such as high blood pressure, lowering the amount of cholesterol and saturated fat in your diet. I remember a long time ago seeing some joke that was going around on Facebook, how will you come out of this pandemic looking like the strong, buffed Thor, or looking like the overweight, out of shape Thor from the Marvel movies. So some people have taken this as a time, as an opportunity to exercise and try to focus on their health and well-being. And some people have used this as an excuse to, well, I don't have to worry about it right now. Let me eat my jelly donuts. I will get back to taking care of myself after this is over. And it is so important, don't feel like you have to wait till COVID is over, because, it may not ever be. There will always be some form